Good evening. This video is going to address some or 5 categories of disability as described by IDEA, and the information provided in this video will be very helpful in planning instruction for students with different abilities. I will begin with autism, one of the categories of disability. Autism is a spectrum disorder typically characterized by the individual lacking social, behavioral, and communication skills. Academically, this will manifest as selective interests, resistance to routine changes, difficulty understanding concepts, difficulty expressing themselves, difficulty expressing themselves, which could cause stress, anxiety, and frustration. Socially, there is little to no interest in others, and again, the resistance to change in routine. Communication-wise, there will be little to no eye contact, and the individual often chooses to be left alone. Sometimes is uninterested in conversation, but will be attentive to other sounds, repeats words for phrases instead of normal conversations, and having trouble expressing their needs. We will move on to the next category, visual impairment. This disability is an incapacity which impedes one's ability to see. If eyewear can correct the visual impediment, then it cannot be included in this category. So suitable examples of visual impairment would include blindness, partial blindness, and other sight problems, which again cannot be rectified with eyewear. Academically, visual impairment manifests typically in a decrease in ability to gather information from visual depictions of information being taught, or the complete absence of the ability to gather information from visual depictions. Socially, this will manifest a visually impaired person is, of course, typically unable to partake in social events which rely heavily on visual input. Communication-wise, there will be a lack of proper eye contact, tracking, etc. It can cause social awkwardness, which could negatively impact communication with others. I would think that a person who is having so much trouble communicating would naturally maybe climb back into their proverbial shell. The student may have to resort to utilizing Braille for communication purposes. Moving right along to the next category, speech or language impairment. Any significant difficulty with using words and voice to effectively express oneself. That's the typical or main characteristic of a speech or language impairment. Also, any significant issues with processing language expressively or intrinsically. This will manifest academically as an inability to perceive and understand information and dissect for understanding. Also, the inability to express information can impede learning in the classroom. Socially, student speech may not be intelligible, which could cause social awkwardness, and the student may shy away from social opportunities and participating in class. Communication deficits. This would present as unintelligible or absent speech, causing for breakdown in expressive communication. Also, if a person is unable to decode messages due to complete inadequate brain function, the individual will be unable to utilize any information given to them to effectively participate in learning and communication on the whole. Next is ADHD. This is under the other health impairment category. This disability negatively affects one's ability to pay attention, and the individual typically exhibits impulsive behaviors and is overly active. Academically, this will manifest as an inability to focus and attend to lessons. Socially, there will be uninhibited behaviors, i.e., echolalia, repeated behaviors, which could impede positive social reactions. Communication wise, echolalia and utilizing words inappropriately or in place of actual conversations can inhibit proper communication and social interactions. Lastly, we have the gifted exceptional student category, and we know that gifted students typically perform very superiorly, academically speaking, compared to their peers. If aptitude is not observed and addressed quickly enough, the student can become disinterested in school and exhibit misbehaviors. A social deficit would be that students may socially outperform their peers and require more apt socialization, whether with older students or in a group of individuals who think similarly to themselves. And communication wise, gifted speech is typically characterized by intellectual concepts. If the other listeners are not able to understand the concepts, there will be a breakdown in communication. We will take a closer look at the autistic student and helpful instructional strategies for learning, because of course this video is about differentiated instruction. I chose to zone in on the autistic student and how best to help them. We know that autism impedes one's ability to communicate and interact with others. So 3 effective strategies for learning and integrating social and communication skill building would be interviewing students, grouping students with similar learning styles, and sharing your strengths and weaknesses strategies. In interviewing students, this allows the teacher to spend time with the student one-on-one in order to know what it is that they are learning. It also gives the child the opportunity to practice communication and proper social behavior. In grouping students with similar learning styles, this helps encourage the student to participate in group work with students who work like them. It allows for opportunities for communication with the rest of the group and collaboration to help problem solve. This helps with collaboration skill building. The share your strengths and weakness strategy offers the student the opportunity to interact with the teacher one-on-one again, so that they're not overwhelmed by a large audience, and they learn to become comfortable in their strengths and weaknesses academically, socially, and aspire to learn how to circumvent their weaknesses, as the teacher explained that he or she has circumvented theirs. For your consideration, I have included my references. Thank you so much.